Welcome in. This is Christy Hendricks with Change of Shift, and my guest today is Clarice Warner. Clarice has been helping people successfully achieve their goals of medical coding certification for over 15 years. Her education in health information management and her experience as a coder, auditor, and compliance officer gives her a broad base from which to approach any topic. Clarice is a long-standing member of both the American Health Information Management Association and the American Academy of Professional Coders. She is also the girl with the pearls who enjoys motivating and inspiring people to achieve their goals. All right, so I want to welcome in Clarice Warner, the girl with the pearls.
Thank
Clarice.
you, Christy. Hi.
I love that, and I can see that you have your pearls on right now.
Yes, ma'am.
Don't go anywhere without them. Okay, so Clarice, typically I interview nurses, and you're actually the first non-nurse that I'm interviewing. So why don't you tell me, let's start out with, what are your credentials?
Sure. So I am a registered health information administrator, and that is a American Health Information Management Association credential. Pretty much says that I have knowledge of everything regarding health information management, can run a health information management department, have involvement in every level of information related to that, including now that we've shifted to more electronic medical records, including the electronic medical record. I also have coding credentials. I am a CCS-P, which is a certified coding specialist physician base. That's also an American Health Information Management Association, or a HIMA credential. I have my CPC, which is the Certified Professional Coder, which is an AAPC, or the American Academy of Professional Coders credential. And I am also a compliance officer. So I have certification in healthcare compliance, which is the CHC, with the Healthcare Compliance Association.
Okay, well, that's great to hear, because now what that tells me and what it tells our audience is that you're so ideally suited to talk to us, to talk to nurses about coding. And why don't we start out with just a brief history of your career,
Okay.
Prior to, teaching courses in coding.
Okay. So way back in the day, back in 1993 is actually when I became involved with health information management. I wanted to, actually 1991 is when I actually went to school. Wanted to do something in allied health, but didn't want to be involved with blood and gore. So I was introduced to more of the business side of healthcare, and health information management was an option. And so I said, well, wow, this is great. So I went through a 2-year program and received my associate's degree, and there's also an associate degree credential, which is the RHIT, and I had that first. And from there, worked in several places with that. I've worked in physician offices. I've worked at the VA here locally. I've worked and actually traveled with the VA, because I was actually an auditor with the VA on their physician documentation. I worked at hospital settings, etc. And then I fell in love with coding, and I fell in love with the aspects. I'm the type of person that, which is where my compliance training comes in. I'm the type of person that I need to know the why. I need to understand the parameters around why we do what we do. Making sure that we're doing things appropriately and ethically, and of course, compliantly. So, coding sort of afforded me that opportunity, because there are rules, there are regulations, and there are guidelines in order to code services and diagnoses appropriately. So I sort of fell in love with that. The books that we had back then were probably about 150 pounds that we were carrying every day. So I wasn't really in love with that, but it was a great segue into the compliance portion of my career. So then, as I involved myself with coding, I felt the best way to show my skill was to get my certifications. And so I sat because you have two national organizations, I wanted to have my hands and feet in both organizations. So I sat for both of their coding credentials and received those. And has been working with coding ever since. So went on to further my education, received my bachelor's degree in health information management, and then sat for the RHIA credential. And again, that, just lets folks know when they see that, oh yeah, she knows everything about health information management. So.
Okay. Now, so how long were you coding or involved in that, working in that space before you started teaching others how to be a coder? So
I started teaching specifically to certification. My business has been in existence since 1999. And it sort of just came naturally to me, understanding that there's and as nursing, I think you all are also involved in sort of standardized testing from a state perspective. So understanding that, yes, you need to understand and learn the skill of coding, but you also need to understand and learn how to take a standardized test, in our case, a multiple choice exam. So while mastering that skill, I also try to give folks information on test taking strategies and techniques. And so as I was coding and looking at different things, I'm like, okay, this will be a great question. This will be a great coding question. And from there, that's how I built our teaching platform in order to do that. And then as I was working in some of these various entities, they would come to me and say, well, Clarice, could you design a quiz for us? We have some new hires. And oftentimes you're required to take some type of, coding quiz for an entity that may be interested in pursuing you for employment. And so I would also put together some, just some basic things, general knowledge things that people who identify themselves, and this was before certification was a big deal, but who identified themselves as coders should know. And so we would put together, and from there, I'm like, okay, maybe there's a need here, and there's something that I can do. And so I started teaching.
Wow. Okay. So what do you think now? Our viewers are nurses that they, for whatever reason, they're looking at leaving nursing, probably leaving clinical nursing, but wondering what else can they do with a nursing degree. Some of them leave because they're burnt out of the clinical setting. Some may leave because they have to, because of a physical injury or an illness. But why would nurses make good coders?
Great question. Nurses would make excellent coders because of the clinical background that they have and that they bring to the table. So while the education and training portion of becoming, in my world, a certified marketable medical coder involves understanding and knowing medical terminology, understanding and knowing anatomy, nurses bring that additional pathophysiology. They bring that additional disease process component. They bring all those additional components that they've learned through their nursing career and experience that they've had into that process. So when they're coding, say they're coding for a surgery or a particular surgery, they understand specifically so say you're an OB nurse and you're coding for Uh, uh, let me think of something off the top of my head. Maybe a hysterectomy, and so they understand the processes, what types of things that could potentially go wrong, what types of things could potentially go right as it relates to that surgery, particularly if they have specialized in that area. They understand any pain thresholds. They understand because in my experience, and I have nurses who are friends, it's really the nurse who actually runs the world. The nurse actually
Yeah, we don't always admit it, but yeah, that's what we're thinking. Yeah.
It has been my experience. The nurse usually teaches and trains, documents, and provides the information for the doctor to then give their clinical assessment. But really, it's the nurse who is the nuts and bolts and the glue that holds that whole thing together. So your nursing experience and clinical background would be helpful for the coding professional, because you can actually see the bigger picture and you can see it clinically versus here's a diagnosis or here's a service or a surgery that is being performed. And yet we can take that information and apply a code to it and making sure it's the appropriate code based on the guidelines. But then you can see the bigger picture, especially with ICD-10, where, things are now more specific and, based on, lab results or based on other information, you would be the person who could query the physician and know right off the bat, well, wait a minute, they also are experiencing these types of symptoms, or they are also having these types of disease process in conjunction with this. So maybe we need to ask the physician, like you would normally do in your nursing documentation. Maybe we need to query the physician to say, okay, I've identified that their labs are this or their labs are that. Would you consider this being another diagnosis that the patient may have? And so bringing that type of expertise to the table would make nursing folks excellent coders.
Nursing folks. Okay, I like that. All right, now I'm kind of wondering now, if you're a coder, are there coders that have specialties? And the reason
Yes.
I'm asking is because, like, my background in nursing was primarily NICU, neonatal intensive care. So I was like, I wouldn't know what to do with an adult. So can a coder specialize? And so if somebody like me, maybe they could do just NICU or just pediatrics, and then maybe there's like coders that do other things like big people?
So there are some specialties, but the specialties are more like you have a radiology or interventional radiology specialty. You have orthopedic specialties. So they don't necessarily specialize between big people and little people, but they specialize. But we have, of course, wherever there's a hospital facility and there's bills going out the door, you can believe that there are coders that are involved. So with it in Children's Hospital, there are coders that, and oftentimes the codes don't necessarily differentiate, particularly the diagnosis codes. They don't, or the procedure codes don't necessarily differentiate by, the whether it's an infant or a child or an adult. Now, there are some that do. And then, of course, you have disease processes that may be congenital for a patient or something that they've acquired, in a young age or, below the age of 18. And there will be specialty codes for that. But usually the specialty, as far as a coder is concerned, it's based on the specialty of the provider or the practice.
All right. I have so many questions for you. I don't even really know where to start. Well, let's start at their education. If a nurse wanted to be a coder, so a nurse has already gone through a bachelor's or maybe a master's, what additional education would he or she need to undertake before being able to actually get that first job as a coder?
You're not even required to have a degree to be a certified coder. You just need to pass the certification exam. So with that being said, that the nurse walking through the door already has the necessary, whatever education level she has, she's good. He or she is good. I didn't want to leave the gentleman out who may also be nurses. They're fine. So there's no additional formal education that they need. They just need to understand and learn the skill of coding. And there is a skill behind it. Because as I mentioned, there's guidelines and rules and regs specifically to coding. So similar to their protocols. So you all would have protocols on how to treat a certain type of patient. You could sort of use that same analogy for coding. There are rules and regs, or there are protocols, if you will, on how to use a particular code.
Okay.
You understand that makes it so much easier to be able to apply the codes appropriately.
Okay. All right. So a nurse could go in and just sit for the exam, but would that be, she still needs to learn.
She would need to learn that skill of coding. So
yeah, because they don't teach us coding. We have familiarity with ICD
with some codes, right?
But as far as actually doing the coding, that's like what you teach, is that process. Okay. Correct. So somebody finishes your course and they're feeling much more confident in knowing the skills that they need to be a coder, and they go sit for those coding exams.
Correct.
Put themselves out. All right. Now do coders, if you're a coder, and I know that there's all these different credentials for coding.
Yes.
But if you're a coder, do you have to work for a hospital or healthcare organization, or can you be a freelance coder?
You can be a freelance coder. You can be a remote coder where you're working from home, either at a hospital, at a physician practices. You can work in insurance companies. Coders actually code the birth certificates and death certificates. So you can work at the Bureau of, so they're all, yes, they work in insurance realms. They work, where are some other non-traditional places? Because, so let me give you, I guess, a little history on coding. And I know we use coding for reimbursement purposes primarily, but the codes are actually more for statistical analysis. So when you hear in the news that, so many people have died from XYZ disease and the percentage is X, they get that information from the codes that are either assigned to the death certificates or codes that are in patients' records or documentation that is, that information and that data is transferred maybe over to insurance companies or research companies. So there are other areas that are like non-traditional that coders are used for. So you're not necessarily chained to the hospital to be a coder. So there are all kinds of opportunities out there related to that. And then of course you have teaching.
Right. And then you have teaching too. Okay.
That's right.
That's okay. What would you say, what are the first 5 steps that a nurse would take if she wants to be a coder? What would you recommend that she do? Those first 5 things that she does.
First 5 things for a nurse, if she's interested in coding, is one, she again would vary from what I would tell somebody fresh off the block, but it could, because she already has the medical terminology, which is key. You have to be able to understand the language of the land. And that's where medical terminology comes in, as well as anatomy. So she can already check those off. She would need to get into a coding program, because remember, coding is a skill and you need to know how to actually perform that skill. And so being in a coding program, you would hopefully, a good coding program such as mine, you would be taught not only the actual skill of here's the diagnosis, how do I assign a code to it, but making sure you understand why you are assigning a code to it, making sure you understand the reimbursement implications related to it, making sure you understand, like I gave that little brief history about, the statistical analysis and the data that is required from that, making sure you understand compliance and ethics. That is very, very important, because oftentimes people are coming into our field, particularly in smaller offices, smaller physician offices, and they may say, I want you to code this. And it doesn't jive with what the actual guidelines say. Well, unfortunately, you have to make a choice at that point, because, you know, as a certified coder, you are bound by coding ethics, and there are ethics on both sides. And so you need to do the right thing. And oftentimes folks are faced with those types of choices. And so I also provide some options related to that. So just finding a great coding program to learn that information would be the next step that I would recommend for a nurse. Understanding, and this is where, because I've taught physicians to be certified coders, and I've also taught nurses to be certified coders. So while having that clinical background is a blessing, sometimes it can be a curse, because you want to, at some point, diagnose the patient that you're coding for. And so while it's beautiful to have that knowledge, sometimes you have to pull away and say, well, this is not my patient and I'm not diagnosing. Let me code what someone else has provided the clinical assessment for. And so that's where sometimes we run into, because they were like, well, wait a minute, I see this other thing going on here. Why are we not coding that? Because they didn't mention that in their documentation. And the documentation is basically what you have in order to code. And so if you want them to add that, then that's when you would have those additional conversations. I would also, if they struggle with, it's really about practicing and application. So once they've gone through a coding course, the testing is let me tell you, the testing is a time test. And sometimes there's test anxiety related to that, because it's a 150 question test and you're given 5 hours and some change to take it, which is a lot you got a lot of questions in relatively a short amount of time. And so knowing your coding manuals, knowing the skill of coding, and practicing under those time constraints really makes the person successful in getting their certification. So practicing, in my course, I know we do lots and lots and lots of exercises, and I provide lots of practice. And then I also provide time tests for them as well, so that can sort of curb some of that testing anxiety that they may have. From there, I would suggest certification, because again, that's where you show them that, you know what you know your stuff. Most places are looking for certified coders, and there is a high demand, but the supply is rather low. And so that's why it's one of those careers that it has just boomed. And it is continuing to boom. And if you look out on the, and I can't think of the website off the top of my head, but they talk about the job outlook and the job projection. Mm-hmm. Medical coding is one of those that is projected to continuously increase through, I want to say like 2020, 2022. So, yeah.
Okay. Boy, I have so many questions going through my head. Now you said something about you sit for the exam, but then once you sit for the exam and you pass the exam, then are you not then certified?
You are certified once you pass that exam.
Okay.
If you have not coded and you don't have, and I'm speaking strictly to the American Academy of Professional Coders exam. So if you don't have at least 2 years coding experience, then you take the same exam as everybody else, even those people who do. But you're given an A. So your certification would be CPC-A, and it's for apprentice. And so at that point, you need to get that 2 years of experience under your belt to remove that A. So again, you're certified. You walk through the door with the certification, but everyone knows that with the A, that you are also needing that additional 2 years of coding experience that you need to get. And then one way that you maintain, because once you take the certification exam, one way to maintain that credential is that you have to have CEUs. every 2 years is when we report our CEUs. And I want to say there are like 27, 28 CEUs that are required every 2 years. And you can get those in a multitude of ways. You can get them through attending national conferences. Sometimes that's out of reach, unless your employer is actually sending you there to get those. And that's great if they do. You also have local chapters. So there is a chapter in virtually every city around the country that you can plug into, and they have monthly or bi-monthly meetings, and you can sit into those meetings and get your certificate or your CEUs. The organization also puts out a monthly publication, and that monthly publication really just gives you updates and hot topics and trends and whatever is going on in the business of healthcare. And they also have quizzes that you can take. And so you can take all of those quizzes, which would help you get that CEU requirement met for that every 2 year period.
Okay, all right, and that makes perfect sense to nurses, because we renew our license, we get our CEUs, and we renew our nursing license. Let me just because I don't know these things, so if I don't know, I'm sure there's one other person out there in the world that doesn't know these. Tell us the different designations that there are for coders. There's RHIA, I'm looking at your qualifications, CCS, CPC, help us make sense of all of that, and where do we start?
So I would suggest, one, you take a look at the website. So AHIMA has a website. AHIMA is the American Health Information Management Association, and it's ahima.org. And AHIMA is the oldest. AHIMA is the oldest organization that we've had. And some history on AHIMA, it pretty much encompasses everything health information management. So they weren't founded just on coding. It was everything. So your tumor cancer registry, your release of information, HIPAA, even though that's relatively new, but release of information sort of ties into that. Doing data analysis, some of their quality reviews, all of those types of things that all fall in your traditional health information management department that you see is what AHIMA was founded on, and primarily for acute hospital care. The AAPC came along years later, so they haven't been in existence as long. They've been around, I want to say they came out in the 80s, early 80s, and their focus was coding, specifically professional coding, so physician coding. And as the years have gone on, they have expanded their credential base and reach to all types of coders. So coders in inpatient hospital, coders in post-acute settings, coders in that will, as we mentioned before, interventional radiology, coders in orthopedics, so a specialty coder, but primarily circled around the physician, and not necessarily your inpatient hospital setting. But again, they've expanded into that, and so that's another arena. So if you are strictly looking to be in a hospital setting, both organizations can help you. Now, AHIMA also has coding credentials for physician, and I have the CCS-P is the one that they offer for specifically for physician coding. So those are the two organizations. I would also advise to go out to the AAPC website, and it's aapc.com, and you'll find information. And like I said, there's no way I could name them all, because I want to say they have like 28 credentials. It's like every year they have something else, and it's like they have something specific for a biller. So if you want to be a biller, there's a certification to be a biller. If you're looking specifically for auditing, there's a certification for that. I also teach an evaluation and management coding class, because there's a way to teach it for the certification exam, and then there's a way to teach it and know it for practical everyday purposes. And so, because there's a variance, they can't give you every kind of scenario that could potentially happen in a testing environment. And so usually folks who are coding, evaluation, and management become auditors. And so there are credentials for auditing as well. There's credentials for the insurance portion of it. So if you want to be certified in understanding coding related to reimbursement and claims, there's a credential for that on the AAPC side. So they don't necessarily, I always tell people, get as many alphabets behind your name. It's like alphabet soup. So the more credentials you have, the better suited you are to market yourself and show your level of expertise in the area that you've chosen.
Wow. I think I had no idea how the depth and breadth of this profession.
Yes. And it's like I said, when we started way back when, CPT was relatively new, and which is one of the actual coding systems that you use for procedures. And from there, it sort of just ballooned. Now, the diagnosis codings have been going on for years, but CPT, who the American Medical Association is the person or group responsible for putting together the CPT books that we get every year. From there, it sort of expanded. And so that's where you have some of that bifurcation of various avenues and areas you can go in which to specialize in coding.
All right. Now tell me, I want to hear about the different associations and groups that a coder would belong to and what benefits they have from belonging to those associations.
So the benefit to belonging to any association is the networking opportunities. So even on the local, all of them, let's take them one at a time. AHIMA, because there are some similarities and there are some variances. AHIMA, once you become a national member, you automatically are also a state member. So they're very vocal in advocacy. And so when you hear about, things going on, like clinical documentation specialists, they're all over that. That's something that is part of the Health Information Management Department. So that's something that AHIMA involves themselves in. Right now, the new buzzword, I think, is data governance. And so they're all over that as well. Health information exchanges, because we're in an electronic medical record. Those are the types of things. So their reach is bigger. They have a huge base, and they're looking, while they are aligned with the business of healthcare, similar to the AAPC, they look at all components. So they're involved in the regulatory pieces. They have folks that are lobbying and sitting at those congressional tables to say, well, wait a minute, this is what we're seeing based on what we do in our world. There needs to be a law or something needs to be changed related to that. So they're involved on that level. So the networking opportunities are endless, and you have opportunities to join committees. You have opportunities not only at the national level, but at the state level. They also have a local chapter. So there is a local chapter. Usually it's affiliated with a school that may be in your area. So with AHIMA, the RHIA, the RHIT, those are, again, formal educational based credentials. So you walk away with a degree prior to sitting for those particular certifications. So you can easily identify someone who is degreed versus someone who is not. But again, they're at the federal, the state, and the local level. AAPC is, you don't necessarily have to have any type of degree for those types of certifications. Again, they're focused primarily on the physician, and coding is their business. So they're all about the business of healthcare and what that entails. And so a lot of them sort of morphed from billers. Oftentimes people think billing and coding is the same thing, and they're not. So most of them morphed from the billing world into the coding world. and became certified as a result from that, or became more involved into the regulations. Medicare is like the go-to guide as it relates to coding. And so you have to have an understanding and grasp of your Medicare manuals, Medicaid. And now that we've embarked out here on Medicare managed care, there's some additional opportunities with that, as well as commercial payers. And so you have to be, you have to have some knowledge and understanding related to the payer world as well. So as far as being parts of these organizations, the sky is the limit, because there are so many different areas and arenas of people that you would meet depending on what background they have, where they're coming from as it relates to their position. So I always say, networking is the primary thing that they provide. But then they also provide camaraderie with folks that are in the same trenches as you are. So both organizations have, so once you become a member, there's like a separate little portal off of their websites where, you dialogue and hey, I got questions about this, or is there anybody specializing in this? Or, we've been getting denials on XYZ. Is anybody seeing this type of trend as well? And what are you doing? And so it's a way for the people to discuss whatever issues, even in the education realm. Hey, I'm struggling in getting my students to understand the appropriate way to address XYZ. Anybody has some tricks or tools that can help me make sure that I provide the students with the necessary information that they need to be successful. So again, across the board, you have a knowledge base fed by the members that can assist other members in whatever questions or issues or concerns that they may be having at the time. So that's another reason to be involved. Again, I'm all about marketing yourself. So it's another way to be marketable, because at this point, say you're isolated to one type of, so say you work in a small rural physician office, and so you don't have the exposure to other types of coding. Well, this provides you that opportunity. Or say you want to advance in your career, and yeah, I'm a coder today, but I want to, run this department, or I want to be the VP over health information management, because it will rise up to a VP level, particularly in a hospital or a large hospital group. So those are opportunities where you can meet those types of people and pick up a phone or shoot them an email or talk to them and say, hey, can you give me some information? I mentioned earlier the coding ethics that are surrounding the profession. And so they're very diligent in making sure that folks understand that, similar to nursing, when you treat a patient, you are pretty much, that patient is in your care. You're taking care of that patient. That patient expects you to assist them in whatever that may be going on with that patient. Similar to, what we do, not of course to that level, because yours is more life or death, but our patients expect us to make sure that the reimbursement or the billing that they're receiving is appropriate. And we sort of are in the middle of that, because we're making sure that what's documented is reflected in the bills that are going out. We're making sure that there aren't any errors related to any types of documentation. With HIPAA, that is huge right now, because you need to make sure there are no, and the electronic medical record, that because it stays forever, there's no issues where, well, Jane Doe's information is now in Jill Doe's chart. Well, how did that happen? So you have to be stewards and, ambassadors of that medical record, and making sure that things are documented appropriately. There is something called a legal medical record. And so you need to make sure that the appropriate items are in that record, and definitely reflects the care that is being provided to the patient. So really, you are, particularly at the health information management level, the stewards of all things information. And as a coder, you're making sure that on the business side of things, that those things are accurately reflected in that documentation and accurately reflects the claims and bills that are going out the door, and for the reimbursement that the facility is receiving.
All right. Now you have several courses that you teach for, people who want to go into coding. And what I'm learning now is that there's so many different areas of coding. What tell us some of the courses that you teach?
So my core program is the online medical coding course. And that particular course prepares an individual for certification, as well as provides the skill for medical coding. Our course is broken down, and I have it online, but I also do the face-to-face here locally. Our course is broken down into 14 modules, where we begin everything from medical terminology, anatomy. We teach thoroughly ICD-10, going through the history, the compliance and ethics related to diagnosis coding, understanding the reason why we code diagnosis, and then going through the various guidelines and regulations. From there, we go into the CPT codes. Primarily, my students want to be certified through the AAPC. And the AAPC exam is heavily weighted on CPT. So I pretty much tear that book apart. And each module is each component of CPT. So you have your surgery component, which breaks down the entire body, integumentary system, musculoskeletal, skeletal, cardiovascular, et cetera. So we go through each individual component of the body. We also look at radiology coding. We look at anesthesia coding. We're looking at pathology and laboratory coding, as well as other general medicine services. There's also HCPCS coding, and that's primarily your drugs and medical devices. And so we teach you, because there may be like 10 or 12 questions on your certification exam related to that as well. But I also give you the skill of teaching you how to code HCPCS as well. So that's the primary course. Again, you go through the entire history, the conventions, because if you've ever seen a coding book, there are all kinds of symbols and dots and numbers and everything in that particular book. So I'm teaching you what those things mean, because there's a method to the madness. And so I'm teaching you that information as well, but also preparing you for certification. The other piece is evaluation and management coding. And evaluation and management coding really is based on really two caveats. One is the office visit, so the traditional office visit that you have with your provider, and the documentation. And there's a way, and most folks call it counting bullets, but there's a way that you actually code for that. And you really have to take that documentation by that provider and break it up and cut it up. And it's like putting together pieces of a puzzle in order to get to the appropriate evaluation and management code. And so I teach a course specifically in evaluation and management coding as well. Years ago, folks were concerned and worried about coding becoming automated and coders no longer being necessary. Like, well, if everything is going to go through a computer, why is coding necessary? Well, believe it or not, there will still be a need, even in the electronic medical records, because one, someone with a coding background has to provide the information about the data that's being inputted into those computers and the algorithm for the electronic medical record. So that's another area of, expertise that a coder could potentially bring to the table as it relates to that. So if somebody is involved with or has a passion for IT related items, that's another segue that they can go into. And then you are auditing, because the physician, and even in some of the clients I've had, the physician is the one that's actually providing the code through the electronic medical record. but somebody needs to verify that. And so the coder becomes the auditor, because they can then take the information and verify that, yes, the documentation does truly support that information, or it doesn't.
All right. Do you now, with your courses, then do you also provide courses or the CEUs that you would need to get as a coder so that you can certified every 2 years?
I have looked into that. It used to be more of a streamlined process to do that. As the years have changed and the organization sort of have changed hands, they still offer that. I just haven't gotten into appending those to my actual courses. But yes, there is an opportunity to add the CEUs to it as well.
Okay. Okay. All right. I'm like, whoo.
I'm sorry.
No, it's great information, because actually, when I was in clinical practice, probably 4 to 5 years ago, maybe it was longer, I actually was kind of looking into coding, because it just sounded really fascinating to me, because I was examining things like compliance also, because actually in a past life, before I was a nurse, I was going to go to law school. I was a legal assistant, and so I was really kind of fascinated and interested in compliance and risk management.
Yes.
I was looking into all those, things like that. I did look into coding, and all that. It sounds a lot like nursing, where in nursing there's so many different specialties that you can go into. Uh-huh. And what it sounds like with coding is that there are also so many areas that you can specialize in.
Correct.
So now, what is the difference then? Tell us a little bit more about the difference between a coder and an auditor.
So the coder is more or less your front line. So your coder is, the physician document or the provider documents the information. They take that information and they assign the appropriate code to it. The auditor sort of reverse engineers that. So the auditor says, okay, this is what you said this should be. Let me validate that the documentation that you have actually supports that. So that's primarily the difference between the two.
Okay,
you still need the same skill set in order to accomplish them. You're just approaching it from a different perspective.
All right, I see. What, I have so many questions. Wow. It's like I just opened this big old huge new world in coding. Is there anything else that you can add?
Again, because the demand is so great and the supply is so low, I encourage any and everybody with an interest in coding to jump on board. I too know folks, particularly in the nursing field, who for usually either they've burnt out, because I know you guys have crazy hours. Those 12-hour shifts can be rough, and or for health reasons, it's very physical work that you do oftentimes, depending on, again, the type of nursing that you specialize in. And, while in your mind, or when you embarked on this particular career, you may have thought, well, yeah, this is something that I can do for 10, 15, 20 years. And unfortunately, circumstances may prevent that. So I would encourage, even if you're not necessarily interested in certification, which I do encourage you get, because that shows that you're an expert in that area, having the skill set and having the knowledge of coding actually markets the nurse too, because it gives you some additional insight on. And I know you were taught, document everything. Right. There's a reason why you're documenting everything. And so you can get some of that background. Oh, I understand why I need to make sure. And of course, it's for continuity of patient care and making sure that we are taking care of our patients appropriately. But, there are other ramifications to things. And as you know, we're going into tracking quality measures and tracking the lives of the patient and having, the medical homes for patients where, we are involved in the entire care of a patient. Understanding, where some of that comes from, understanding the history and the background, that's where you can get some of that information just from a coding perspective of, oh, okay, I get it. I understand how what I do as far as the frontline person dealing with and providing the care to the patient, how that translates into the end result or the back office functions for the actual reimbursement that both the facility gets and or the insurance providers get for the care that you're providing to the patients.
Right, exactly. Now, I do have a question. If you're an apprentice level coder, does that mean that you would have to work for a company, a healthcare organization, a hospital, insurance or whoever? If you're an apprentice, and the reason I ask that is because if you have that designation and you're an A code and you're an apprentice, would it be difficult to just work from home and be kind of freelance because you're really still learning? It's almost like you need a mentor, or you need to be in that position as maybe an employee.
You could potentially, I probably would suggest going and getting the experience right off the bat in a facility, either a hospital facility, post-acute care facility, or a physician office. So again, so you can understand the realm of the business of healthcare. But as far as the actual coding process, it's the same. And so you don't necessarily have to have that in order to do the job. So I know I have a friend who owns a consulting business, and she hires coders to, they either go physically to locations where, say, coders are, they're needing coders because they can't find coders to fill the vacancies that they have, or, vacations or maternity leaves or whatever. And so she will send coders to those particular areas. She also has coders that work remotely. And because of the electronic medical record, it makes it so much easier to work remotely, because you don't have to have a physical record in order to do your job. You just have to get the appropriate accesses into the electronic medical record system that entity has.
Right.
So again, you can do it from home. Usually they have a great network. And so you're part of a department. And so if you have questions, or if you have concerns related to what you're coding, you can always pick up a phone, shoot an IM, whatever, to get the assistance that you need. So you don't have to go to a practice, but if you feel that you want to better understand and get a feel for that, then that is an option, but you don't have to, even as an apprentice.
Okay, I see. Okay, now let me just touch on this, because I know that, there are going to be nurses that this is a great concern. It would be a great concern of mine too. What would you say, and I know it's really hard to nail this down because every state in the country is going to be different. What is a ballpark amount, a ballpark salary or pay that a coder would make?
So as a brand new coder coming out of the door, on an average, you're looking at, and this is not an AHIMA side, because of course you would have a degree and that would boost your salary. So if you don't have a degree, you're just walking into the coding field, you're probably looking at $38,000 a year, just brand spanking new, which probably is nothing to a nurse in the nursing field. It's like, wait a minute, I know I make way more money than that.
Right. And nurses, and nurses do make more than that. But it sounds like something that she could do if a nurse is working per diem. Like I worked per diem for a long time. Mm-hmm. And so I would work 6 shifts a month, 6 mm-hmm. shifts in a schedule. So like a 4 or 6 weeks, I think it was a 6-week schedule. I don't know. So I'd work like 1 or 2 nights a week. And so I could easily then also be doing coding on the side until
Correct.
I can kind of get up to speed, drop that apprenticeship.
That's right.
Kind of really jump into it. And then I'm sure that once you lose that apprenticeship designation, then you're able to earn more.
Yes.
Would that be
definitely
correct?
able to earn more. Again, with experience, you're able to learn more. And then it depends on the specialty that you go into, because like an orthopedic coder is going to make way more than someone who just goes into primary care, because you're probably just doing, just regular E&M coding, versus with orthopedics, you're doing surgeries, you're coding some E&Ms, but you're primarily coding the surgeries that are occurring at those facilities. So that specialty level plays a part in the actual salary that you receive as well. And then, as you mentioned, your geographic location plays a piece. And then if you get multiple certifications, so you don't have to stop at one, you can, say you get the general primary, but you just have a burning desire to specialize. Having that extra, that's why I say as many alphabets, it's like alphabet soup, as many alphabets as you can get behind your name, the better that you can market yourself and put your foot out there and ahead. And then again, with you as a nurse coming in with that clinical, but that's what you sell. That's what you sell to any, I'm not, right. I may be relatively new in the coding arena, but I have the clinical background that you would need. I know why they're doing what they're doing, and that's what you sell as you market yourself.
Right.
For coding.
Right. So there's a big difference between somebody coming out of, say, high school or an associate degree and then going straight into coding versus an experienced nurse and even an experienced registered nurse.
That's right. That's right. And so you can require more and you can ask for more as far as a salary. Yes.
Right. I see. Okay. Well, you know what? This has been just an amazing interview. I've learned so much. It makes me want to go be a coder, actually. So now, tell us once again tell us your website again and how people can get in touch with you, and a little bit about how they can enroll in your course.
Sure. So again, I'm with the Professional Reimbursement Network, LLC, where coding education is key. And my website is Ohio, OHIO, as in Paul, or professional, RN.com. So it's OhioPRN.com is the website. From there, you can find links to look at the course offerings that we have.
And can I jump in just for a second, Clarice?
Yes, ma'am.
Can you just screen share and show us your website?
Oh, I don't know if I know how to do that.
If you just kind of scroll or mouse down, you'll see on the bottom a little green button that says screen share.
Okay.
Can you see that?
I do.
So you can just hit that, and then do you have your website up in a browser?
I can pull it up. I don't know if it's up when I...
Or I can go ahead and screen share while you talk.
Okay, we can do it that way.
Okay, so let's do that, because I do already have your website up on my screen. Okay, so now can you see your site?
I do.
Okay.
So this is where we provide the information related to our services. Off to the side, you see our classes. We currently have a free course, actually, that talks about the 5 steps to become a certified marketable medical coder. Again, that provides you similar to some of the information that we discussed today on what those steps are to get to coding certification.
Where is that free course?
Scroll back to the top. Oh, no, you hit classes, didn't you? Go back to home.
Okay. Okay.
If you, the very top, tippy top.
Oh, the very, very top.
Yep. Click here to learn how to become a certified marketable.
Oh, okay. Right. You mean the part that's right in front of my face?
Yep. So click on that. That's correct. And this is your free course for the 5 steps to become a certified marketable medical coder. There's a little promo video there where I, walk you through what you'll see. It's actually an email course, so I'll send you 5 steps over the course of 7 days on what you need to do in order to become that certified marketable medical coder.
Okay.
And then we also have a course on how, because our courses are, some of them are online, we also have a course on how to be successful in an online course. And so once you complete the 5 steps, there is a link to go into the next session, which is to make sure that you have the tools that you need to be successful on an online course. And then our regular coding program is the picture, their online medical coding classes. And you can, no, that's the
video.
Yeah. So if you click on that picture, it opens up to our 2018 online coding classes. And the reason why we changed the date is because your coding manuals, you get new coding manuals every year. Mm-hmm. And the certification exam is primarily geared towards the guidelines. And so they're going to test you on new codes and new guidelines, as well as some of the tried and true. So we update our coursework based on those guidelines that come through every year. So you're not necessarily, you get the basics, but you, depending on the year that you join, you would get things that are specific to the year that you're planning on taking that certification exam.
Okay. Okay, great. Oh my gosh. Thank you so much for sharing that with us.
You're welcome.
I think that's all I've got for today. Have you, do you have anything else that you want to add?
We also have a Facebook group. So if you're interested in joining other like-minded folks, we have the Certified Marketable Medical Coder and Friends Facebook group. You can reach me on Facebook, YouTube, most of Twitter, Pinterest, using the Ohio PRN or under Clarice Warner.
Okay, wonderful. Clarice, thank you so much for joining us. It's just been a pleasure seeing you. And I think this is a really valuable resource and a real, just an authentic alternative nursing career.
Yes.
Very viable for a nurse, and it's really a logical step for a nurse that maybe just doesn't want to do clinical nursing anymore, or is looking for an option where she can practice from home. So I just want to thank you so much for educating us today, and I wish you continued success in your course.
Thank you. Thank you. Well, thank you for having me. Thank you for reaching out and say, hey, you have something that I need to know about. And so thank you. I appreciate that.
All right. So once again, this is Christy Hendricks with Change of Shift. I hope you enjoyed this interview. I know I did. And again, just to your continued success. All right. Bye-bye.